One woman's victory over breast cancer could be a blueprint for future life-saving treatments. She was near death when she enrolled in a clinical trial that used an experimental kind of therapy. It unleashed the body's own immune system to attack the cancer. Dr. Jon LaPook is here to show us how she beat the odds. Good morning.
Good morning, Norah. This particular type of immunotherapy has been used in a limited way for certain types of cancer. But this single case represents a breakthrough for breast cancer and could usher in a more personalized way to treat other types of cancer.
We went backpacking in Nepal. We went rafting down the Grand Canyon.
In 2014, Judy Perkins and her husband Bob were powering through their bucket list after learning her breast cancer treated a decade earlier had returned.
I felt another lump on the same side, and this time it ended up being stage 4. I entered the world of cancer patient, serious cancer patient.
Despite hormonal and chemotherapy, Perkins had run out of options. The cancer had spread to her chest and liver.
I felt bad for my family, but I was grateful for the life I had had.
And you were at the point where you had pretty much accepted
The end.
But in 2015, Perkins found Dr. Steven Rosenberg of the National Institutes of Health.
She probably had 2 or 3 months left to live.
He's a pioneer in immunotherapy, or harnessing immune cells to fight cancer. Genetic mutations in the cancer cells are the trigger causing those cells to grow out of control. Rosenberg's new approach is to find the few immune cells, called lymphocytes, already in the body that can see those genetic mutations and multiply them into an army of cancer killers.
It's a war going on at a microscopic level as these lymphocytes are attempting to find the cancer, expand in number, and then attack the cancer cell.
In a lab, Rosenberg's team grew those few immune cells into billions, then injected them into Perkins's bloodstream. There, just like the immune cells appearing white in this picture, they ganged up to attack cancer cells.
We're developing a new drug for every patient that's suitable for that patient, but no other patient.
Back home, Perkins was at first exhausted and then could actually feel the tumor softening.
And then a year later, it's all gone. I mean, just the odds are so ridiculous that, I mean, I did hit the jackpot. It's amazing.
Circulating in her body are large numbers of the cells we administered to her 2.5 years ago.
In March, Perkins navigated 1,200 miles around Florida by kayak and shows no signs of stopping.
Dr. Rosenberg stresses that this type of personalized immunotherapy is still in its infancy. 2 other women did not respond to the treatment, but he envisions a day when a patient will routinely be treated not with a drug, but with an army of immune cells specifically targeted to that person's cancer.
Oh, I just got the chills. I mean, such an incredible story.
Yeah.
Very exciting
Great
news
to
when
see.
it works. Thank you, Jon.
Thank you.